session we had discussed about the Pura Rupa of the different types of the Jvara, Vataja, Pittaja, Kaphaja, Jvaras. Now continuing from that part, the Vataja Jvara Lakshanas. Vepatuhu Vishamo Vegaha, Kantos Parshoshanam, Nidra Nashaha, Kshatastambo, Gatranam, Dokshamaja, Shiro Hrudgatra Rug Vatra Vairasyam Badhavit Kata, Jimbha Ardhanam Tata Shulam Bhavati Anila Jvare. In case of Vataja Jvara, there would be tremors or chills like feeling and dryness in the mouth, and the patient would have disturbed sleep. There will be a reduced appetite, will be even sort of dryness throughout the body, pain throughout the body. That's the most important, is the pain throughout the body, and constipation or even yawning or distension of the abdomen. The most important is the pain. Now, these kinds of the clinical symptoms are seen in almost every sort of the fever conditions in the initial stage, fever sense stage. We have discussed about the 3 stages of the fever earlier. In the earlier stages of the fever, after the prodromal symptoms, as the temperature rises, the pain in the joints throughout the body is a very common feature. That too, very common seen in case of viral fevers. Most of the viral fevers would have that kind of a presentation where there will be shivering, pain in the throughout the body, and the patient's metabolic rate would be higher. So the patient may have a irregular appetite. Either there could be loss of appetite, nausea, and so on. Now, this is a common feature in all cases of viral fever. In the viral fever, most of the viral fever conditions, you will have that kind of a presentation where initial stages would have a Vata Lakshana, the middle stage, the stage of febrile would have a Pitta Lakshana, recovery phase would have a Kapha Lakshana. But there are certain of the conditions which may have these kinds of the symptoms persisting for a longer duration, almost throughout the course. One of the example would be chikungunya. Chikungunya, viral fever again, where the typical course is that of the pain in the joints, and that joint pain can persist for a long duration, and even it can result in the deformities, and that can be obviously diagnosed as Vataja Jvara. And in all the cases of other viral fever, the initial first few days of the fever would be presented as Vata Jvara, and your approach also can be in the same manner like the Vata Lakshanas. Then in case of the Pitta Jvara, Vegaha Tikshno Atisarascha Nidralpatvam Tathavomihi Kantavsa Mukhanasanam Pakaha Svedascha Jayate Pralapaha Katuta Vaktre Murcha Daho Madastrasha Pita Vidmutra Netratum Vaitike Bhamaya Vaja. Now, in case of the Pitta Jvara, there will be high degree of fever, there will be impaired sleep, vomiting can be quite common, even there could be spots of suppuration or maybe ulcers formed in the oral cavity, and there could be excess of sweating also could be seen. The patient tends to have a so bitter taste in the mouth. Even there could be abnormalities of the consciousness, either simply altered consciousness, confusion, hallucination, or even unconsciousness, and occasionally there could be yellowish discoloration as such. Now, other than that of the yellowish discoloration, the other symptoms are quite common in the persistent febrile stage, the middle stage of the fever. That's the majority of the patients would have that. Most of the bacterial sepsis induced fever, patients who have a bacterial sepsis somewhere like a purulent lesion, pus forming lesion somewhere, wound infections, in these conditions, the typical presentation would be of the same feature, like where the patient would have a high degree of fever, and the fever tends to become a sort of constant fever like. Very specifically, these kinds of the symptoms are seen in majority of the enteric fever conditions. In the typhoid conditions, in the beginning itself, you may have that high fever, chills, and the gastrointestinal tract symptoms, ulcers in the mouth. They are very characteristical shape. Now, all these varieties, all these clinical presentations can be considered as the Pittaja Jvara variety, and the protocol of the treatment of Pittaja Jvara can be applied at that stage. Now, the Kaphaja Jvara Lakshanas, Gauravam, Shitam Utklesho, Romaharsho, Atinidrapa, Soto Rodho, Rugarpatvam, Praseko, Mazrasita, Natyushna Gatada, Chabdihi, Angasato, Avipatada, Pratishayo, Aruchikaso, Kapajo, Akshanoscha Shuklata, Kapaja Akshanoscha Shuklata. In the deference stage of the fevers, majority of those conditions, the symptoms of this sort would occur. Usually, the patient would have a heaviness in the body, and the temperature would be comparatively lesser, and there will be sleepiness. Patient feels like sleepish like, and there would be discharges from the oral cavity or discharges from the gastrointestinal tract, and even angasadaha, a sort of debility and impaired digestion. Cold-like symptoms, cough also may be presented. Of course, majority of the patients who have the fever and then during the resolution phase, depression stage, these kinds of the symptoms are common. Moreover, in the conditions where the fever is produced due to granulomatous infective conditions like tuberculosis, quite commonly leprosy, in such conditions, the typical presentation of the fever would be of the same low-grade fever, which may have certain periodicity. In tuberculosis, it's more in the night, evening hours, and in leprosy, it could be like a constant fever-like conditions, so on and so forth. So, in such chronic conditions, you may have the singular clinical presentation, and these symptoms could be considered as a kaphaja Jvara. So, resolution phase of any febrile condition or febrile conditions produced due to granulomatous infective conditions like tuberculosis. When I say one example, that doesn't mean that it's only the tuberculosis or only the typhoid and so on. It could be plenty of such conditions, but clinically, based upon the observations, we can make out the dosha lakshanas in case of the febrile conditions. Then in case of the tridoshaja, nidranasho brahmaha shvasaha tandra suktangata aruchihi trishna moho madastambho daha shitam hridivyatha paktihi chirena doshanam unmadaha shyavadantada rasana parusha krishna sandhi murtha stiragujaha nirbhukne kalushe netre karnau shabdarganvita pralapah srotasampakah कूजनम चेतनाच्युति स्वेदमूत्रपुरीषाणां मल्पशुचिराद श्रुति सर्वजय सर्वलिंगानि. In case of the Tridoshaja variety of the Jvara, the symptoms could be wide varying. More than really the fever, the symptoms will be more of a systemic involvement like impaired sleep, giddiness, breathlessness, and a tired feeling, and this anorexia, thirst, even impaired consciousness of different degrees, and there could be even comparatively coldness, feeling of coldness in the body, impaired digestion, even psychological disturbances like there could be personality changes also, even including symptoms which mimic that of the schizophrenia like symptoms, or the psychic symptoms could occur. There would be changes in the color of the teeth, the tongue becomes rough or maybe blackish, and the pain would be presented in the joints. Eyes tend to become more congested, conjunctival infiltration could be there. There could be the tinnitus like symptoms, and the srotasampaka, ulcerations in the mouth or in the anal area, or even there could be abnormal peristaltic movements. Even incontinence could occur, and the condition may persist for a longer duration. Now, these kinds of vague symptoms and comparatively persistent fever is common, very common in case of endogenous pyrogen-induced conditions like the tumor necrosis, patients who are on radiotherapy, or patients who are on chemotherapy, autoimmune diseases like SLE, rheumatoid arthritis, leukemias. In these conditions, the fever would be of the same sort. There would be different pattern of the fever, but which tends to be consistent, persistent for a long duration with the variable symptoms, and the systemic symptoms are more common, and majority of those conditions could be considered as a Tridoshaja variety. Now, the Vishesham Chatrasro, the further specific symptoms in case of the Tridoshaja Jvara would be Natyushnashito Alpa Samnyaha Bhrantapekshi Haratsvaraha Kharajipah Shushkakantah Svetavinmutravrajitaha Sasvo Nirbhugna Bhakta-dveshi Hataprabha Shwasan Nipatidashyete Pralapa Upadravayitaha Tam Abhinyasam Vityahu Hatojasam Athapare. Abhinyasa is the central fever, a fever which is involving the central nervous system. Of course, any febrile conditions can involve the central nervous system, but certain of the fever conditions, particularly like that of the systemic involvement conditions like lupus, SLE, etc., even other viral fever also, many of the organisms, they have a higher preference for that involvement of the central nervous system, but or it could be related to the genetic constitution of the patient. some of the patients are more susceptible for that. Children usually are more susceptible to the central environment, or even the symptoms in case of the meningitis-like conditions also can present with the similar symptoms, where the fever may be undulant. There could be repeated episodes of increase and reduction of the fever, and more of the neurological symptoms, like the patient may have the impaired consciousness, and even he may have that pralapa, that's irrelevant talk. Such conditions with the apparent clinical symptoms of a generalized weakness, and the patient would have abnormal movements of eyes, voice would be very faded voice, tongue will be dry, and throat also would be dry. There may be impaired or these irregular bowel movements also can occur. Such condition is called as abhinyasa. So abhinyasa is actually a central fever. I would keep that general word, central fever. When I say central fever, it's not only limited to the meningitis-like conditions. So if in the gross medical terms, central fever represents the conditions like meningitis, cranial abscess, etc. It's not only that much. Even the conditions like leukemias, SLDs, when they present with the advanced conditions, where the patient's immunity is lesser and the patient has a chance of developing the febrile complication, or even in case of other high degree fevers which can result in febrile seizure-like conditions, could be considered as abhinyasa. So abhinyasa is one of the stages or one of the variations of the tridoshaja jvara. And this also is considered as Sanipata. Sanipata Jvaram Krucham Asadhyam Aparividuhu, and Sushila had considered these conditions as Asadhya. Nidropetam Abhinyasam Kshidamenam Hatojasam Sanyasthagatram Sanyasam Vidyat Sarvatmake Jvare. In the Tridoshaja Jvara, when the Abhinyasa occurs with a person who is persisting having fever, and the Ojo Lakshana, the vital signs are, Boja Lakshana are the vital signs. Vital signs are affected, like pulse rate and blood pressure, or maybe the ventilation is affected, and the patient is having a contractures or tetany-like conditions, that's the seizure-like activity. That's also a Tridoshaja Jvara, which is asadhya. Now, we have discussed about the usual course of the fever as such, but in many of the febrile conditions, from the contemporary science point of view, there can be a stage of hyperinflammation. See, the normal or the usual febrile conditions, early stage of fever sense, then there is a maintenance stage, then there will be a defervescence stage. But there could be occasionally, due to mainly the host inflammatory response phase, where the patient's inflammatory response is poor, there could be a stage of hyperinflammation. Instead of the resolution, the condition may go into a hyperinflammation phase. Now, this hyperinflammation phase was well studied, and one of the very classical signs of the COVID-19. In the COVID, this was well established, and whatever the graph I am showing is from the COVID pattern as such. But it's not only in the COVID. In many other conditions, you may have these kinds of the presentations, and the clinical symptoms at that stage of hyperinflammation could be acute respiratory depressions, or there could be shock, or cardiac failure also can occur. And the clinical signs could be inflammatory markers like CRP or IL-6 or D-dimer, ferritin. These could be raised as such, which is the common clinical signs. Whereas in the middle course, its usual symptoms like shortness or hypoxia. These symptoms are very specific for the COVID, but even in other conditions, the symptoms can mimic these. But a hyperinflammatory phase in any febrile condition is one of the possible complications which could be produced due to either increased virulence. Even in case of typhoid-like conditions, a hyperinflammation stage may result if the patient is not treated properly, or if the patient has a poor immunity, or it also can occur in any other febrile conditions. Even in a septic focus, it can result in a hyperinflammation if the source of inflammation is not tackled properly. So hyperinflammation is one of the possible complication of any of the septic conditions, and the typical pattern which is shown in this present graph is for the COVID variety, COVID sort of things. In others, there could be a slight variation in the pattern of the graph, but the situation is the same. A hyperinflammation stage could occur, and that's exactly what is named as abhinyasa. Now, ojo visramsadeyasya pittanila samuchayat sagatra stamba sheetabhyam shayanepsu hachetana api jagrat swapan jantuh dandraluscha pralapavan samsasaroma sastango manda sandapavedana ojo nirodhajam tasya janiyat kushalo vishakar. The same complications also can be considered as ojo nirodhaja jvara, where the vital functions could be affected. Ojas is assessed by the vital functions. When we say study of vital functions, it's exactly the assessment of the ojas. And with the ojo visramsa results due to the abnormality of pitta and vata, and it results in the impaired response to the heat and cold. Gatra stamba sheetabhyam, there will be impaired response to the cold. Particularly what happens is in a typical septicemia conditions, the temperature outside the body, external temperature measured would be less than normal, subnormal temperature should occur. But if you measure the core temperature, that's in the oral cavity or the rectum, the temperature would be raised. That's exactly what's mentioned as the Gatra Stambashita. There would be coldness at the periphery with the Jvara inside, and or even later on we'll come to another word, Antardaha, and that Antardaha also is a similar issue. The patient would be feeling like sleepy, impaired consciousness would occur, and even if you are waking up, he may not wake up fully. Even there could be irrelevant talk as such, and the patient would have persistent continuous pain. That's considered as the ojo nirodhaja jvara, where the vital functions would be affected, which also is a feature of hyperinflammation. Now, usually these kinds of the complications of either hyperinflammation or central fever complications, they tend to occur by saptame divase prapte dashame dvadashe piva punar ghorataro bhutva prasham yati hantiva. Now, these diseases usually in the normal pattern by 7th, 10th or 12th day, they will have a resolution. If there is no resolution of the fever by 7th, 10th or 12th day, it can become worsened and it can result in complications of central fever-like conditions. That's what Sushruta says. From the current point of view, I think this time interval is not an important criteria. It's not given the due importance as Sushruta has mentioned. Many of the patients may have that central nervous system symptoms in the beginning itself. Febrile seizures mania can occur even before the patient has a identifiable temperature rise occasionally, but on an average there would be usually these complications tend to occur in the chronic phase, the later phase, and though the duration mentioned by Sushruta of 7th, 10th or 12th day is not a very rigid issue, but if the fever persists for a longer duration, we should expect the complications. Now, when a patient presents with these febrile seizure conditions, from the current point of view, we usually make them assess them under two categories: simple febrile seizures and complex febrile seizures. And that basic difference between that simple febrile and complex febrile seizures are complex febrile seizures present with the central nervous system signs like focal signs, like where there could be deviation of the mouth or maybe impairment of the movements on one side and so on. And the seizures can persist for a prolonged duration for more than 15 minutes. Such conditions are considered as a complex, which are usually due to the central nervous system pathology like meningitis or cranial intracranial abscess, etc. Whereas the other way would be, it can be presented with the either the usual presentation would be the patient would have initially, once there is a fever, the fever may affect the hippocampus area, that's the hypothalamus area, the interleukins, and as a result of that the body temperature rises, and this also results in the increase in the temperature of the brain. When the temperature of the brain is raised, the nervous system becomes more active, and due to simply the increased temperature, the nerves may become hyperactive. Or it also could be presented due to many of these neurotransmitters like GABA, which becomes mutated, or sodium channels may even become altered, and there could be these interleukins which are increased, which can result also in a hyperactivity in the nerves, which results in increased glutamate level and reduced GABA level in the brain. So once there is increased glutamate and reduced GABA level, the excitability of the nerves would be affected, and hence the patient would have these symptoms of either seizures or impaired consciousness and so on. And this is the usual protocol with these febrile seizure or abhinyasa conditions which have to be done. And in the present day situation, in any of the patients, a lumbar puncture is necessary to rule out the central pathology. This is the protocol which is to be followed now. Whereas Sushruta has mentioned the clinical signs alone. The other protocol of investigations are not really specified, which we can add on, but the clinical signs and stages were identified by Sushruta. Then Drishta Murcha Brahmodaha Swapnashaha Shiroruja Kanta Asyal Shosho Vamathu Romaharsho Aruchistula Paramidashta Jirumbata Vata Pitta Jvarapratishedhapart in the Dvanda Jalakshanas, Vataja and Pitta Jalakshanas. Of course, these stages or these symptoms can be seen in the patients exactly in majority of those, though we may not be able to specify the causes from the current point of view, like a patient with common cold or common typhoid-like conditions. But these symptoms can be seen in any of the patients with febrile presentation, and these dosha lakshanas can be assessed. And if you utilize these dosha lakshanas in the clinical management, then definitely the results will be much better. Now, how I would prescribe and what's Sushruda's regimen of treating these conditions, will come to that when we go into the next part of the chikitsa. But clinical evidences are when the patient has excess of thirst, giddiness, or even loss of consciousness, burning sensation, impaired sleep, headache, and dryness in the mouth, vomiting, or the erector pili, the has become erected, parvabheda, that's pain in the joints, yawning, that's typical of Vataja and Pittaja lakshanas. That's the Vata Pittaja Jvara. And Straimityam Parvadam Bhedaha Nidrova Gauravam Evaja Shirograha Pratishaya Kasa Swela Pravartanam Santapo Madhyavegasya Vata Shleshma Jvara Kriti. Straimityam is a feeling of coldness. It's defined as Ardra Vastra Gunthanam Iva Bhavaha, as if you have covered your body with a cold wet cloth. That kind of feeling, a feeling of coldness. And Parvadam Bhedaha, pain in the joints, excess of sleep, heaviness in the body, headache, and discharges from the nose, cough, and even sweating, burning sensation, and moderately high fever, not very high fever. These are the typical features of Vata Kaphaja Jvara. Lipta Atitiklasyata Tandra Moha Kaso Aruchi Strusha Muhurdaho Muhshitam Slesham Pitta Jvarapratishedhapart. A patient having a bitter taste in the mouth and an impaired this alertness and cough, then reduced appetite, thirst, and burning sensation, occasionally cold feeling, a hot feeling, alternating as such, is a kapha pitta jvara. Jirumba agmana mada utkampa parva bheda parikshaya trit pralapa abhitapaha syur jare martapaitike. In Vata Pitta Jvara, there would be more of yawning, distension of the abdomen, and tremors or involuntary movements of the body, even parvabheda, pain in the joints, and reduced vitality. That's it. Parikshaya is reduced vitality. Excess of thirst, then pralapa is again altered speech or irrelevant speech. Burning sensation would be in kapha pitta jvara. Shula kasa kapha utklesha shita vepatupina saha gaurava aruchi vishtambaha vata shleshma samudbhave. In vata kapha jvara, there would be more of pain, cough, and discharges from the body, and there could be even vepatu, tremors, or chill-like conditions, pinasaha, that's cold-like symptoms, heaviness in the body, or even constipation. That's typical of Vata Kapha Jvara. Shitadaha aruchi stambha veda sweda moha madabhramaha kasa angasala shullasaha bhavanti kapha paitike. In Kapha-pitta Jwara, there would be again coldness as well as burning sensation, aruchi, anorexia, and slumber, reduced movement or feeling of reduced movement, and there could be excess of sweating, altered consciousness, cough, pain throughout the body, and salivation are the clinical symptoms there. These are the typical clinical symptoms of the Dvandvaja Dvara. Important is these conditions can be easily assessed clinically if you take the history, and these cannot be correlated to the causes as we see now. See, when we see a patient of fever now, we will be assessing from the current point of view what could be a cause, like whether it is a viral origin or bacterial origin or so on. But in any case of that, the clinical presentation would not be absolutely uniform. That minor variations in the clinical symptoms in terms of that grading of appetite or rate changes in the presentation of body ache, headache, nasal discharges, etc. These can give a clue about the dosha lakshanas, and irrespective of the current concepts or current perception of the fever, when it comes to the question of selection of the drugs and management, these can be very much relevant, and we need to develop that kind of a clinical acumen where these symptoms can be assessed and the dosha lakshanas can be even made out, or which can help in the planning of the management. Then the other variations in the presentation of the fever could be krishanam, jvaramuktanam, mithyahara viharinam, dosha salpopi samruddho dehanam anileritaha, satata anyadyushka trayakya chaturthan sapraleptan kavasthana vibhagena yathasankyam karoti. The fever could be presented in the later stages. When it becomes chronic, it can present with the different sorts of presentations, particularly either a fever or jvara condition which is not treated properly, or at times it could be due to the nature of the disease itself, that there could be the recurrent fevers or chronic fever conditions where the fever could be persistent. And when it is persisting for a long duration, it can present with various presentations of the periodicity, and those periodicities are mentioned by Sushruta as satata, anyadyushka, trayakya, chaturtaka or sapralepaka. The satata is a continuous fever, anyadyushka is once in a day, which reaches the peak once in a day, trayakya is once in 3 days, chaturtha once in 4 days, and sapralepaka is where there is a continuous setting as well as the fever together, and or this can be produced due to involvement of the kapasthana, and these numbers also would be suggestive about the severity of the involvement of the kapasthana. Ahoratra sthanat sthanam prapadyate tatascha amashayam prapya dosha kuryat jvaram dranam. This kind of a periodicity of the fever could occur due to the movement of dosha from the amashaya to other sthanas, other locations, and either it could be the normal cycle, there would be the variation of the doshas, movement of the doshas according to the time, the vayo aho ratri bhuktanam te antamadhyadika kramat, depending upon the status of time, the food and so on, there will be variations of the doshas. Diurnal changes of the doshas would occur normally, and corresponding to that, the fever pattern also would change, and the whatever that periodicity is mentioned or is presented as a exaggeration of those diurnal changes. Tata pralepako jnayah shoshinam prananashanah dushchikitsidamo mandaha sukashto dhatu shoshakrita. A pralepaka jvara where the patient would have a sweating as well as the febrile condition together and persisting for a longer duration, longer than the usual time of 7, 10 or 12 days, or those conditions which are presented with the emaciation, it can be prananashana, it can even be fatal, and it's very difficult to be treated. Kapasthane shiva dosha tishtan bhitri chaturshva viparyayakhyan kurte vishaman krichasadhanan. A disease jvara which locates at the kapasthana may present with the variable presentations. The presentations may just miss all that whatever is mentioned, and these are considered as viparyaya, jvara viparyaya, where you cannot fix that periodicity. It's a very highly irregular type of the fever, which also is a Vishama Jvara, and it becomes a Kristasadhya. परो हेतुः स्वभावो वा विषमे कैश्चिदीरितः आगन्तुश्च अनुबन्धो हि प्रायशो विषमज्वरे. Now the Vishama Jvara, the Jvara becomes a Vishama. Now all those patterns which you have discussed as a Satadanya Dishka, they are all the descriptions of the Vishama Jvara. Vishama Jvara could occur due to either the Swabhava, that's the type of the pyrogen or the source, like typhoid fever, these filaria, malaria, these have a typical periodicity from the beginning itself, which is very characteristic, and many times we make use of that pattern as a sign of clinical diagnosis or one of the major factors of the clinical diagnosis, and that's what is Swabhava. At times it could be due to the complications which occur later, either due to impaired patient response or maybe the more increased virulence of the organisms, like if the patient has having a systemic disease, and even a common cold can result in the major complications which otherwise usually heals, or it could be the other way depending upon the type of the virus, that could be the presentation will be varying. So that Vishama can occur either as Swabhava, where at the time of the onset of the disease itself could be Vishama, or it could become Vishama as Anubandha later on, so due to the systemic complications. Now, this is a very important concept. Like, see, generally it's defined that Vishama Jvara is a Jvara which doesn't yield within that specified duration of 7, 10 or 12th day according to Sushruta. Charaka has mentioned 7th day, the limit is 7th day. If it is beyond that, then it's considered Vishama Jvara. That's one aspect. The other aspect is Vishama Arambhaka Jvara. Charaka has mentioned these conditions as Vishama Arambhaka Jvara, where at the beginning itself, there will be a Vaishamya and the pattern would not follow the same pattern. Now, Sushruta has given some more descriptions about the reasons for these kinds of variations. Vatadikatvat pravarnititajnaha tritiyakam chapi chaturthakam cha aupatyake madhya samudbhave cha hetum jvare pittakritam vadanti. Now, the Tritiyaka and Chaturthaka Jvara are produced due to aggravation of the Vata. In such condition, there will be more predominant Vata Lakshana. Tritiyaka and Chaturthaka is when the fever has a undulant character, which is having that frequency once in 3 days or 4 days, tertiary or quaternary fever, which is now the term used now, that's considered as the Vata predominant Jvara. Whereas Madhya Samudbhaya, if it is due to the consumption of these inebriating substances, similar pattern also can occur due to Pitta aggravation. Pralayapakam Vatabalasakam Kaphabikatpena Vadantitajnaha. If there is a persistent continuous fever with the sweating as well as the fever persisting, then it is Vata Kaphada Jvara, where the Kaphadika, the Kapha would be more. Murchan Banda Vishama Jvaraja Prayena Te Dvanda Samukita. So, in general, impaired consciousness and persistence of Vishama Jvara, they are produced due to more than one dosha involvement. Taksau Shleshma Anilau Shitam Adau Janeto Jvare Tato Tayoho Prashantayo Pittam Ante Daham Karotja Karoti Adau Tatha Pittam Taksam Daham Ativata Prashante Kurdas Tasmin Shitam Ante Tavapi Dvavetau Daha Shitadau Jvarau Samsargajau Smutau Daha Purvastadyo Kastaha Kricha Sadishta Smritaha. Now, the pathogenesis of increased temperature in the body is clearly explained as such. The initial changes would occur in the surface of the body. Taksau Shleshmanilo, the Kapha and the Vata in the surface of the body, they produce or they get impaired in the Jvara in the beginning. It's quite true that in any case of the febrile response which we have discussed under the control of the hypothalamus, majority of the conditions, the first response would be the response related to the heat loss. The blood vessels to the skin will become constricted, sweating would be reduced, and those symptoms are the beginning, initial symptoms in majority of the conditions, and that's exactly what Sushruta has mentioned. Then after this, the next would be Pittam Ante Daham Karotya. There will be changes in the Pitta functions. The metabolic changes would occur in the next stage. So it is usually the following response. The first response is the cutaneous response. The next response is the metabolic response, where the GIT functions would be affected, which results in the involvement of the doshas. Now Sushruta says, because that metabolic response also affects the Tvaksta Pitta, the Pitta in the surface of the body, there will be more of burning sensation. Then later on, due to the involvement of the kapha, there will be a feeling of coldness. The patient would have chills. Now chills, which we usually see, is a response of the hypothalamus to raise the temperature of the body, to set the thermocouple at a higher center, to increase the generation of the heat, that the chills would occur as a contraction of the muscles. Now Sushruta says this is a response of the kapha, involvement of the kapha. So the sequence of the changes in the pathogenesis of the fever is clearly described as the initial conditions of the superficial surface doshas of kapavata, then the core dosha of pitta, then again there will be involvement of the kapha, which results in the chills and raise in the temperature, or it could be involvement of the doshas in various combinations. So Dvavetau, Dahashitavi, Jvarau, Samsargajau, Smrito, Dahapurvastayo Kastaha, Krichasadhyascha Smritaha. If at all this sequence is changed, and if a patient presents with the burning sensation in the beginning, without that the cutaneous changes, all of a sudden developing a high fever, could also be a sign of poor prognosis as far as Sushruta. It's also true, which we call as a irregular type of the fevers. प्रसक्तश्च अभिघातोक्तः चेतना प्रभोस्त्यः रात्रेस्मौ षट्सु कालेषु कीर्तिरेषु यथा पुरा प्रस्यह्य विषमो अभ्येति मानवं बहुधा ज्वरः. The abhigatokta due to the trauma, or chetana prabha due to the impaired or altered psychological behaviors. When the jvara occurs, it can occur at any time of the day depending upon the onset of that injurious factors. It can occur any part of the day, and they also would have a vishama course. The psychological issued induced fever conditions or stress induced fever conditions, trauma induced fever conditions may not follow the usual pattern. Sachapi vishamodeham kadachit vimuchati glani gaurava karshebhya sayasmanna pramuchate vegetu samatikrante gatoyam iti lakshate. The Vishamajvara also can have a spontaneous resolution occasionally, or even with the treatment. When it resolves, it gradually it can result in involvement of the system, like there could be a impaired consciousness, heaviness, or emaciation. And if it doesn't follow, or if it doesn't resolve, then there could be the same complications could occur. But when it resolves, the pattern, that typical pattern would be affected. So if the typical pattern is changed, like a diurnal fever has become now a constant fever, low grade fever, that's a sign that your treatment has benefited and the patient is having a course of resolution. Now, the another complications or another cause of the Vishamata is a धात्वन्तरस्थो लीनत्वात् न सौक्ष्म्याद् उपलभ्यते अल्पदोषेन्द्रः क्षीणः क्षीणेन्द्रः इव अनलः दोषो अल्पो अहितसम्भूतो जरोस्त्रस्य वा पुनः धातुम् अन्यतमं प्राप्य करोति विषमज्वरम्. A febrile condition, a fever condition which is either improperly treated, or it could be due to the disease pattern itself, or it could be due to the physical condition of the patient. The causative factors of the dosha, jvara, may remain dormant for a considerably long period, and later on, due to some triggering factors, the disease can be presented. Now, this is a very important presentation, that many of the febrile conditions can remain latent for a long duration, and later on they may produce the complications, and these are either due to leena dosha, which is accumulated in the dhatus, or the doshas or the disease which moves on from one level to the other, involvement of further more and more tissues or more and more organs of the body. That also could be the cause of the Vishamadvara. So another pattern of the Vishamadvara. Now, as far as the latency of the disease, many of the disease factors which we know now, like Epstein-Barr virus, HIV particularly, is well known to have the latency period. Now, with the HIV pattern, now this graph is mainly about the HIV pattern, where initially there will be viremia, then a long period there will be no symptoms at all, there will be asymptomatic phase. Then later on some situation due to some extraneous factors, it may result in a presentation of actual immunocompromisation. And many of these viruses, herpes virus, cytomegaloviruses also may have a typical presentation where the duration and the pattern may change, but a period of latency is one of the characteristic features where the person may become a carrier, but still he will not be disease free, and that latent viral issues are one of the major issues from the medical point of view now. So to list all that would be beyond the scope of our discussion, but I am just suggesting about those. That's about the Lina dosha conditions. Now further about that Santada Satada, or that periodicity, Sushil gives some more description about this periodicity. Satadam Rasaraktasah, so Anyedhu Pishirashida, Medogata Triti Ani, to Asti Majagatas Punaha, Kuria Chaturtagam Ghoram Antakam Rogasam Varam. If the patient has a continuous fever, it's usually due to Rasaraktasah, involvement of the Rasa and Rakta. If there is a fever which is occurring once in a day, ambulant fever which reaches once in a day, that's suggestive of the Mamsa Dhatu. When it involves Medogata, Megodhatu, that will be Tritiyaka. The fever tends to become once in 3 days. And when it is involving the Asti or Majja, it could be Chaturthaka, once in 4 days. And these are suggestive of poor prognosis. So periodicity of the fever also could occur due to involvement of the different dhatus or different organs of the body, tissues of the body. Kechit bhuta vishamguttam bruvate vishamajvaram. The vishamajvara, the pattern of the jvara also can occur due to external factors, extraneous factors, which is bhuta vishanga, which we call as infective, the pattern of the infection. As I said about malaria, the pattern of the malaria itself is a periodicity, because the organism has a life cycle of periodicity. Malaria has a periodicity. Typhoid has a pattern of periodicity because of its immunological reactions, and so on. Now, Sattaham Dashaham Dadashaham Mathapuva Santatya Yu Avisargi Syap Santadas Nigatire. A Santata Jvara is defined by Sushruta as a disease which is not a fever which is not resolved by 7, 10 or 12th day, and it becomes continuous, then it is called as Santata Jvara. These words, definition of these words in Vagbhata and Sushruta are slightly varying. There is a mild difference in that description, but still not a very major issue. Ahoratro Satatakavu Dau Kalu Anvartale, Anya Dishkastu Ahoratra Ekakalam Pravartale, Tritiyahne Chaturtayahne Chaturtakaha. Again, further description of the same. Ahoratra Satatakaha. If there is a fever persisting for whole day and night, then it's a Satataka which is persisting for both the day and night. Anya Dishkastu Ahoratra Ekakalam. Anyadishka is when there is a fever once in a day at any time. And Tritiyaka is when third day, Chaturthaya, Chaturthaka, fourth day. Even the present day situation, the fever patterns are described in various terms, which may not have the same clinical relevance as mentioned by Sushruta, but many of these could be helping in the diagnosis as such. The typical patterns which are mentioned are quotidian fever pattern, which is often due to malaria falciparum, plasmodium falciparum, where fever reaches once in a day, peak once in a day. Tertian fever pattern, where the anyodishka, where the peak, fever reaches a peak once in 2 days, is usually type plasmodium vivax or vivax. In plasmodium malaria, usually it's a cotton fever, that's once in 3 days or 4th day the fever would occur. That's in case of malaria. Or even otherwise, usually the patterns of the clinical fevers are again mentioned irregular and undulant in case of the typhus or even pneumonia, and even sepsis conditions also it could be again irrelevant or irregular fever as such, which is also called as a penivalent fever, where you cannot define a pattern, and when it results in these pleuritis, usually it reaches a peak once in a day. That's the typical feature, and at times even there could be temperature which is below normal. Then in case of malaria or other conditions, and there is a persistent fever, but it reaches a peak at irregular intervals, it could be called as recurrent. Now these terms are not very significantly important, but this also is one of the patterns which are discussed. Like in tumors, Hodgkin's disease, etc., there will be a irregular peak. The peak may be reached at one day, then again there will be regular fever, then again a low ebb, then again there could be higher, and a typical pattern cannot be described, which is a typical pattern of the fever in tumors, particularly Hodgkin's disease. In some viral diseases, it may again, a pattern may change. One episode, the duration could be shorter, then there will be a normal temperature. Another episode, the duration may be irregular. These kind of the patterns also could occur, or it can be even named as sustained, intermittent, relapsing, remittent, or hectic fever, depending upon the same issues, which are again are related to certain of the disease conditions. But these patterns are not always confirmatory of the disease, but many times they may help, like lobar pneumonia, where there will be sustained, Satada Jvara, and in malaria, usually tertian or quaternion or primary, what we have already referred. Then relapsing fever, usually where there will be a fever for a few days, then there will be a low ebb, then again there will be a fever, something like Galina dosha or Dhatvantra, or where it goes from one dhatu to the other dhatu pattern, as mentioned in Sushila, as in case of dengue, particularly in dengue, this is one of the important issues. Usually, once the patient has a low ebb, then the risk of the reduced platelet count is high in such febrile conditions of dengue. So it's one of the important issues. Leptospirosis, again, where the renal involvement would occur. Usually, once the patient has a relatively low temperature, the risk would be higher. So you'll have to keep the patient under observation at this stage, at this critical stage, as the critical stage. So that's exactly what's mentioned by Sushila as a involvement of the Gambhira dhatus, one dhatu to the other. So that's about it. Remittent, in case of typhoid, there will be always an ascending pattern. Every day there will be peak, but the peak every day would be increasing day by day. Or hectic fever, which is usually in cases where they may have a moderately low grade fever, and the swings will be quite wide ranging, persisting for long duration, as in case of the tuberculosis, etc. Again, Sushil gives some more descriptions about the Vega, Jvara Vegas. Vatena Udiremanascha, Shiemanascha Savadha, Ekadvidosha Matyanam Tasmineva Udite Ahani, Velam Tame Kurvanti Jvara Vege Muhurmuhu, Vatena Udriyamanastu, Yatha Puriyata Sagaraha, Vatena Udirita Tadvat Dosha Kurvanti Vajvarana, Tata Vega Game Velam Chadaitwa Muhodave. Vegaha no Tadeva Ambha Tatreva Antarniliyate Dosha Vegodaya Tadvadudiyata Jaro Asyavai Vegaha no Prashameta Yatha Ambas Sagaretata. For these types of the waves of the fever, Sushila gives the reason. Reason is due to the abnormality of the Vata. The abnormality of the Vata would produce the movement in the doshas, and corresponding to that movement of the doshas, the aggravation of the fever occurs, and this is compared to the waves in the sea. Waves in the sea also would be corresponding to the breeze which is present around, and also the quantity of the water. So if the breeze is more, the Vegas will be more, or if the quantity of water is more, the Vegas will be more. So to assess the sign clinically, you will have to assess both these factors as such. That's one of the descriptions by Sushila. Shavasya Vishakrite, Dahatisara Hridraha, Abhaktaru Pipasacha, Todo Murcha Balakshaya, Voshadi Gandaje Murcha, Shiroru Komatukshavah, Kamaje Chitta Vibramsha, Tandra Alasya Marotikaha, Hridaye Vedana Chasya Gatram Teparishishati, Bhayat Pralapaha Shokatya Bhavetya Kopatya Vepadu, Abhichara Abhishapabhya Mohas Krishnas Jayate, Bhuta Vishanka Udvega, Hasya Kampana Rodanam. Now, other signs, the Sushila has described the causes of the fever as other conditions like the Oshadi Gandaja are due to that allergens, and fever produced due to psychological disturbances, that may be the sexual urge and so on. So, the pattern of the fever can change according to these causes. In Vishakrita, due to the toxins, there is a tendency for a blue color in the mouth, and there will be more of burning sensation, diarrhea, and there will be cardiac pathology. Cardiac depression would occur in case of the toxic pathology. Of course, in toxic pathology, these systemic signs are true, but not in all. It could be now specific. In case of Oshadikanda Jara, allergen conditions, abhaktaruku, pain in the empty stomach, thirst and impaired consciousness and reduced physical activity and even impaired unconsciousness, headache, vomiting could occur. Or sneezing, Shabaha, sneezing also is a sign. Then Kamaje, due to psychological disturbance, extreme urge, including sexual urge, Chitta Vibrahasha, there will be a psychological aberration and Tandra Alasya, altered activity, physical activity, Arochaka, Hridaya Vedana, pain in the heart, and Gatramja Parishishati, emaciation. Then Bhayaja, due to fever, Pralapa, there will be irrelevant speech. Shokacha Bhaveta, Kopacha, Shoka and Kopa producing, there will be tremors. Then Abhichara Abhishapabhyam, due to Abhishapa, that's curse of others, or due to some of the inordinate activities of others, there could be impaired consciousness, thirst as such. Bhutabhishangata, due to infective conditions, Udvega, Hasya, Kampana, Rodanam, altered consciousness and irrelevant speech, like patient may laugh as such. Kampana, tremors, Rodanam also can occur. क्षमक्षयाभिघातेभ्यो देहिनं कुपितनिलः पूरयित्वा अखिलं देहं जलम् आपादे भृशं. Due to stress, both shama, that physical stress, as well as kshaya or trauma, it can result in visheshana of vata, and the vataja jvara lakshanas would occur in such conditions. Roganam samuttanat vidaha agantatasrada jvaro aparasvambhavati taistaiha nyesha hetubhi doshanam satulingani kadachit nativartade. In any of the other factors which may not be explained and which can produce the jvara, you have to assess the dosha lakshanas, and the whole approach to the jvara would be based upon the dosha lakshanas. With this we will conclude the conditions today. In the next session we will go into the lakshanas of jvara according to the dhatus, involvement of the dhatus. Right? If there are any questions, we will. There are no questions, so we will wind up today.